Hi everyone, so today we're going to show you a neck loading strategy with the specific intention of improving neck flexion, okay? But in this strategy here, we're going to appreciate the interaction between the head, the eyes and the rib cage, okay? Through a lens of trying to express more freezing strategies and freeing strategies, okay? So within this drill here, we're always going to be expressing a freeing strategy between the head and the eyes, and a freeing strategy is essentially a dissociation strategy, where segments move in opposite directions, okay? So for example, if I have my thumb out in front of me, my line of gaze, and I keep my eyes fixated on the target, and I move my head into flexion, my eyes are moving up as my head is relatively moving down, right? So we're getting elevation of the eyes and a flexion of the head and the neck here, right? So those segments are moving in opposing directions. Whereas a freezing strategy is where segments will move in the same direction, okay? So that would look like me looking at my thumb, and when my head moves into flexion, my thumb will come down with the head. So the eyes and the head will move in the same direction there. Now, when it comes to freezing versus freeing strategies, a freezing strategy where segments will move in the same direction presents less of a control challenge to the nervous system. Okay, so we can use it as more of a baseline loading strategy or regression if the client can't tolerate load or handle stress well when segments are moving in opposing directions. Whereas a dissociation strategy or a freeing strategy where segments move in opposing directions, that will present more of a control strategy or a control challenge to the central nervous system, because it needs to allow for an appropriate amount of muscle activity to allow for that relative motion, that dissociation between segments. If there's too much muscle activity, it becomes a little bit more challenging to allow for that relative motion. Okay, so the central nervous system has to trust the capacity of the anatomy to share stress well in order to allow for dissociation. So that's why initially we can load the system in using more freezing strategies where segments are moving the same direction, and then we can progress to more freeing strategies. Now, when we go through this loading strategy here, obviously we're looking at the interaction between the eyes, the head and the rib cage. And the reason why we would often integrate the eyes into a loading strategy is when a client presents with heightened muscular activity or increased tension and tone around the upper cervical region. When there's a persistent increased tone around the upper cervical region, what that may represent is a lack of load sharing between the eyes, the vestibular system and the TMJ and the cervical spine as well. So we want to eventually integrate the eyes, and obviously we're kind of moving quickly through a rehab process here where we're integrating the eyes, but initially we wouldn't really integrate the eyes at all with this. So we're going to use the X here, okay? Now we're going to integrate the rib cage as well. So when it comes to cervical flexion or head flexion, a freezing strategy would be represented by when my head moves into flexion, my rib cage also moves into flexion as well. Okay, so my thoracic spine flexes, right? Whereas a freeing strategy, where the segments are moving in opposing directions, would be when I pre-position my rib cage into extension, and then I flex my head. Right now, with that kind of strategy, you're going to feel a little bit more kind of eccentric load, a little bit more of a stretch through the posterior tissues of the neck, and you might not be able to get as far through the range of motion, but it's often going to present a little bit more of a control challenge for the client. So we'll begin with a freezing strategy where we have the rib cage into flexion, the head into flexion, and then what we're going to do is we're going to maintain the eyes fixated on a target where we can get that relative elevation of the eyes as the head moves into flexion. All right, so we might have to manipulate the position of the visual target. We're going to use an X in this case here, and then as a progression we're going to pre-position the rib cage into extension and then go through the same strategy. Now the movement of the head is going to have to be slow motion here at the beginning, and then we can begin to increase the speed. And once we get generally into the end range of motion of cervical flexion, we can hold in that end range to get some load through the anterior tissues of the spine. We can hold for about 5 seconds, okay? So this is how it's going to look. So we're going to get a visual target in contact with the ground. We're actually going to be in a quadruped position for this strategy. We're going to have the visual target lined up with the line of gaze here. And so what we're going to do then is we're going to position the hands. We're obviously getting some load through the upper limbs here as well. We're going to gently reach through the upper limbs to get that, or to facilitate that flexion of the rib cage. So we're going to gently reach. We can tuck our pelvis underneath as well, just to get a little bit more flexion at the spine as well. And what we're going to do here is maintain the gaze on the X here. We're going to keep it in our line of gaze here. And then what we're going to do from here is we're going to slowly flex the head. And as we flex that head, our eyes are going to be relatively moving up. I'm just going to move this down just so I don't block the mic. We're going to flex the head. Now my eyes are moving up because they're maintaining gaze fixation on the X. And at the end, I can hold that position for 5 seconds. So it's going to look like this. So reach, little tuck under. And then I'm holding in the end range for about 5 seconds. And then return to the starting point. So nice slow motion, hold for 5 seconds at the end. So nice slow motion there. But you'll typically feel a lot of load going through the anterior portion of the neck as you increase the duration. As a progression then from this, what we can do is we can change the position of the rib cage into more of an extension at the thoracic spine. Now we will have to change the position of the X to make sure we're getting that relative motion between the eyes and the head as well. So I'll typically rock back towards the heels so we can get into a little bit more extension at the thoracic spine. In order then to get that elevation of the eyes relative to the head, I'll have to move the X up. So when I come down, I am getting that relative motion, whereas here, if I had the X here, I wouldn't be able to get that relative motion because my spine is in more extension here. So we're going to bring the X up into this position here, get a little bit of extension through the rib cage. We don't have to reach through the upper limbs now because we're just trying to extend the spine, and that will couple with more of a retraction, external rotation of the scapula in this position here. So we're maintaining that extension of the spine. X is in the line of gaze, and we're going to slowly flex the head. And then you'll typically feel a little bit more of a stretch in the back of the neck. We're going to try and pull that chin towards the chest. Hold for 5 seconds again, and then return to the starting point. So just to show you what it looked like in real time. And then back. All right. So obviously the client might be limited with their cervical or with their thoracic extension. But what you're going to do here is you're going to increase the duration of time. So we might hold this for 45 seconds to a minute, and at the point where we're reaching that barrier of fatigue, we do generally want to get the client to the point of mild fatigue so that we're actually challenging the system. Typically they'll feel a lot of load going through the anterior portion of the neck and some stretching through the posterior portion of the cervical spine as well. But it's really just about manipulating the position and the coordination of the segments. So we're looking at the interaction between the head, the eyes, and the rib cage in this scenario. And obviously we can regress this even further by doing it in a more of a supine position where our upper limbs aren't being loaded. But really, it might look like a simple drill just by watching on the video, but when you have to ask a client that might be experiencing increased muscle tension, increased pain around the cervical spine with flexion, manipulating the coordination of these segments can really go a long way to restoring proof of safety to the nervous system. You're trying to establish evidence to the central nervous system that our anatomy can share load well, so that we can reduce the value or the need for top-down protection in the form of increased muscle activity or in the form of increased pain.